Anyone watches the Grey's Anatomy available on Netflix or Code Blue, a Japanese series? If you do, you probably could recall scenes whereby patients' hearts stop pumping on the surgery table and only healthcare workers try to bring the patients back to life. That's resuscitation. There are many forms of bringing someone back to life. DNR can be a vague or a generic term. So you're going to ask me, what's DNR? It is a Do-Not-Resuscitate Order or DNR order. It is a medical order written by the doctor. So what it means is that the scenes that you see on the Grey's Anatomy will not happen because a resuscitate order has been made by the doctor. It instructs healthcare providers not to do cardiopulmonary resuscitation, CPR in short, if a patient's breathing stops or the patient's heart stops beating. DNR is a term generally used by doctors in Singapore to indicate that, should the situation arise, three things are not to be done. There will be no chest compressions performed, no intubation, no mechanical ventilation. So DNR, like I said, is a medical decision. The attending doctor makes it in the best interest of the patient after reviewing patient's medical, functional, and social circumstances. Of course, the patient's wish regarding resuscitation will be considered, but ultimately the doctor makes the decision. Once the DNR order is decided, the medical team attending to the patient will still continue to provide care. The DNR order may alter the care plan, but it will never take away the quality of care and treatment given to the patient from the medical team. Well, I noted that some people treat that the DNR like a death sentence, but there are still things that can be done for the patient. So for example, a patient with advanced cancer who is terminally ill with DNR can still receive antibiotics, IV drips, and palliative chemotherapy. It is not the end of the road for the patient, so it is just a shift in the end goal for a patient who is very ill with a DNR.